Most welcome to each one of you. Thank you for creating time to be part of this Demographic Dividend Luminary Series. This webinar is hosted by the Gates Institute and the Demographic Dividend Initiative. I am Allen Kabagenyi, the chair of the Department of Population Studies, which is at the School of Statistics and Planning, Makerere University, located in Uganda, in Africa at that. I am really, really excited to let you know that we have great experts who are going to be speaking to us, professionals, and who have a wide and wealth of experience that they're going to be sharing with us as we're going to be talking about the demographic transition in Latin America. For logistics purposes, please note that we have translations, and here are guidelines. I'll be slow so that you can be able to follow through, and kindly just click so that you can be able to have the channel which you are interested in for the interpretation. I'll pause to give you a minute to do that so that you can listen in. Also, please note for the Q&A, kindly utilize the chat and then have questions submitted in there. But also there's a Q&A function that you can take note of, that you can use, and it will be very helpful for this webinar. I'm really excited for this webinar. To let you know, we have quite a lineup of presentations that are scheduled here. And we'll begin off the presentations with talking about the demographic resilience in the demographic transition in Latin America and the Caribbean. And Dr. Sabrina will be taking us through that. And then we'll have another one about the rollout of NTAs and its use to inform the demographic policies in the region. After the two presentations, we'll have an opportunity to have a discussion of the two presentations. Later on, we'll have an opportunity to also listen in to the demographic and epidemiological shifts in the region. I'll be presenting the different presenters as they come along. So you know, the hosts of this webinar is what we refer to as the Demographic Dividend International Conference on Family Planning Scientific Committee. So it's part of the conversations and preparations for this year's conference on family planning that will be taking place in Bogota, Colombia. Hopefully we'll have you there. As part of the conveners, I chair the Demographic Dividend Subcommittee, and I'm really excited to introduce the co-chairs who have been behind the preparations for this subcommittee. The first one, I'll begin with Carolina Cardona. Carolina is an assistant scientist at the Johns Hopkins Bloomberg School of Public Health. She's also the technical coordinator of the Demographic Dividend Initiative. We have Alessio Cangiano is the acting chief of population and development at the UNFPA headquarters in New York. We are also honored to have Fernando Ruiz, who joined us recently. Fernando is a research advisor, a monitoring and economics monitoring and evaluation and learning expert at the FP 2030 Latin American and Caribbean Regional Hub for FP 2030. We also have as a co-chair, Professor Latif Dramani, who is based at the CREG Institute at the University of Thies, and myself as the chair of the Demographic Dividend Subcommittee. We're really honored to have each one of you here, and we're going to be discussing the demographic transition in Latin America. But specifically, I would like you to know that this is the 5th of the series of the Demographic Dividend Luminary Series. And this has been happening. We come here, we talk, we have excellent presenters and researchers who have widely published in the area, who come and bring us together to talk about what is transpiring. And this is one of the drumbeat events, as we say, the road to Bogota. So we're really excited to have each one of you. We are going to start off the presentations. And like I said earlier on, I'm happy to introduce each one of them at the time when they come in to talk to us. Our first presenter is Dr. Sabrina Juran. Dr. Sabrina Juran is the Regional Advisor on Population and Development for Latin America and the Caribbean Regional Office of UNFPA. And she leads the regional efforts to promote evidence-based policies that integrate population dynamics into sustainable development, planning with a strong focus on equity, human rights, and the needs of the marginalized populations. She has a PhD in sociology, and she also is a lecturer at the Global Health at Harvard Medical School. I would like you to know that for all our different presenters this morning, this afternoon, from wherever you are, they will have a link or will be posting their links to their profiles so that you can read much more and also see some of the works that they've been doing. Most welcome, Dr. Sabrina Juran.
Thank you so much, Ellen, and good morning, good afternoon, good evening, really, to all of you, wherever you are. I would really first like to thank the organizers for this invitation. And I must say I'm really, really honored to be part of it and truly excited to be speaking to you on the demographic transition in Latin America and the Caribbean, and also about demographic resilience. In the time that I have, I will walk you through the rapid demographic changes that are unfolding in Latin America and the Caribbean, alongside the very complex social, economic, cultural transformations. And as you will see also is that the pace in which this change is occurring, and that also means that we must act swiftly to really adapt our policies, our institutions, our societies, our narratives to keep up with these transformations. So as you will see in the first graph, and that I took from the Demographic Observatory from our colleagues from CELADE, the POP division of the Economic Commission for Latin America and the Caribbean. In the 1960s, the population growth rate in Latin America and the Caribbean still exceeded 2.5% per year. And that implied a doubling of the population every 28 years. Now, by mid-2060, you can see that population growth rate declined. It reversed due to declining fertility. And then in the 2024 revisions of the data, we see an even faster decline, with still very much within the projections ranged earlier, but now population growth is expected to reach 0 by 2050. And that is much sooner than it was originally anticipated. And so these trends really reshape development trajectories across the region and challenge us really to respond with vision and with equity. In the next slide, you see for 2024 that Latin America and the Caribbean has reached a total population of 663 million people. That is 3.8% less than what had been forecasted in the year 2000. Now, for 2050, the 2024 revisions of the World Population Prospects, they estimate that the population is expected to reach 730 million. And while very country-specific differences exist, the regional trend is very clear. Nearly all of the countries in the region now have a much slower population projection, a much slower population growth than previously anticipated. The next slide shows population pyramids. And I think population pyramids are actually a very powerful visual to understand the demographic transition and also really how it impacts age structure over time. And what you can see on the left, what you can really witness also, is the pace in which the region is undergoing the really fastest demographic transition globally. In comparison, the three pyramids on the right, you see 1950, 2025, and 2100. Those pyramids show much narrower bases already, reflecting fewer births, but it also shows a wider midsection representing an increase in the working age population between 15 and 64 years of age that has really driven workforce growth, especially in urban areas, but at least for now, because you can already see how this is narrowing as well for 2100. And by 2100, really, the top of the pyramid significantly widens, right? They are signaling increased longevity and an aging population. And so these comparative population pyramids, they clearly illustrate how demographic dividend is fading in our region. The next slide shows fertility decline. The component that makes up population change, or one of the components that make up population change, is fertility. And in Latin America and the Caribbean, we have experienced a rapid decline in fertility, and that is now reaching 1.84 children per woman. And that is well below the replacement level of 2.1. Now, the pace of which fertility is declining is central to really understanding the closing of the demographic dividend as well. And it's really provides us with the urgency for long-term planning. Fertility is expected to stabilize. It's expected to stabilize at 1.7 children per woman in the coming decades, but it is very unlikely that it is to return to levels above 2.1. And this decline is primarily due to lower fertility among young women of the ages of 20 to 24. Because as you can see in the next slide, while overall fertility is indeed declining, adolescent fertility from girls 15 to 19 still remains very high, and it carries major social and gender implications. And it also very much mirrors the deep structural inequalities by education, by income, and really highlights the urgent need for very targeted policies to promote adolescents' right and adolescents' autonomy. But overall here as well, projections do suggest that fertility among adolescents and fertility among young women will continue to decline.
I'm sorry to interrupt, Sabrina, but there is a disconnect between the slides and your presentation. Sorry, and people are noticing that in the chat. So you already talked about bimodal fertility. I'm very sorry for the interruption.
No, I wasn't yet. I was still on the previous slide on adolescent fertility.
Okay, we can go to adolescent. There you are. Okay.
That's what I discussed, right? It's still very, very high, has major social and gender implications. We do, however, still expect a decline together also with that of young women. But overall, adolescent fertility is still the fertility that is very high in the region. And it really mirrors the structural discrimination and inequalities that we have. So now we can go to the next slide where you see the bimodal fertility patterns. And you can see that distribution of fertility by age has also changed significantly in the region. And so you have overall fertility, early motherhood among lower income women, and a second hump somewhat later on among higher socioeconomic groups. And that pattern, once again, clearly reflects social stratification and unequal access to opportunities of women in the region. The next slide shows migration as a constant presence in the history of Latin America. And today, the region shows a negative net migration overall, as you can see, for the region, but also for the individual countries, with more people actually leaving than arriving. And these movements, they really reshape and they also really accelerate both the changes in size, but also the changes in age structure in both countries, in the receiving countries, but also in the countries of origin. And this impact, of course, is amplified in areas with very sustained immigration. We have some countries where there's a large proportion of young persons leaving the country, and that, of course, not only leads to population decline, but it also really leads to a reproductive potential, a decrease in the reproductive potential of the countries. And that is especially very significant in the English and the Dutch-speaking countries in the Caribbean. The next slide shows you that due to those changes and due to the interaction between the different components, and the proportion of older persons, the proportion of older people in relation to that of the younger and the total population is increasing. And aging is accelerating across the region, but it's also not very uniform. So by 2050, the median age will rise dramatically across all countries. You see up top countries like Cuba and countries like Chile that already have very high median ages, while Chile and Costa Rica will see the greatest increase in median age. On the other hand, you have countries on the bottom like Bolivia, Paraguay, Haiti on the bottom of the graph, Haiti and Venezuela that will experience smaller increases in the median age. And overall, the region that is aging more and the fastest is actually that of the Caribbean. We will expect a jump in the median age in Jamaica from 32 to 46 years. And so what I want to highlight in the next slide is really the coexistence of contrasting demographic realities in the region, but even at the subnational level in between different population groups. And so the image really visualizes the dual pressure of adolescent fertility on one side, but also on aging on the other side, and the reflection of the structural inequalities that the population are experiencing in our region. The next slides show you on how these changes actually lead to the fact that the demographic dividend in our region is fading. And that is a trend that has very profound implications for labor markets, for care system, for social protections. And to understand that shift, if we look at total dependency ratio, when more than 60% or 66% of the population is of working age, the countries are really positioned to harness that demographic dividend. Now, on the graph, you see 3 key reference points that help us somewhat frame and understand that transition. We have 1993 that really marked the beginning of the demographic dividend phase in our region. We have 2029, which is around the corner, and that is really projected to be the peak window of opportunity. But we also know that transforming age structures are already increasing dependency ratios and are really altering the balance of who contributes and who depends on those social systems. And so the projections show that by 2067, we will most likely mark the end of the demographic dividend as aging accelerates in Latin America and the Caribbean. And these structural shifts, they are not temporary, right? They call for forward-looking policies and not reactive measures. And so what we did for today's webinar was just a revision of some of the policies in the region, and the results show somewhat of a mixed balance. On the positive side, there are human development improvements, and also those are significant and measurable, especially in health and in education. But on the other side, when it comes to economic inclusion and employment, progress has been much more limited, primarily due to structural failures, especially in the economy and in the organization of the productive system. So in the interest of time, let me just move maybe to the last slide, because I think what we also really want to take away with is how can we move forward, right? How can we transform some of those social gains that have been made in sustainable well-being? And how can we create a clear focus on decent work, on inclusive growth, and on long-term resilience? And I think we have some key areas where we do advocacy and where we see a potential for impact. And that is first the promotion of decent work. And that means formal, protected, and fair employment, while really also ensuring that growth generates opportunities for all, inclusive and not just a few. There are some key actions that we would highlight in terms of diversifying the economy, investing in care economy, empowering youth, but also really ensuring that these sustain aging societies and promote social justice. I see the hands up, so I know I'm at my time limit. That was our key. So the other two issues would then be the strengthening of institution and long-term planning. And finally, and that's my last remark, all of this must, of course, be anchored in intergenerational equity, balancing the rights and the needs of the younger adults, but also the older generations, moving really away from welfare models towards universal access and accountability, while really ensuring rights are protected across the entire life course. Because ultimately, really, it is not about how much the population grows, but really how rights and opportunities are distributed for all individuals across the life course. Thank you.
So I'd like to invite and welcome Zulma. Zulma is, she's going to be speaking in Spanish, so I would encourage you to connect quickly and link into so that you can be able to see and have the translations. So Zulma Sosa provides, is a population and development coordinator at the Population Division of the Economic Commission for Latin America. Latin America, and the Caribbean region. SOMA provides substantive support on population issues to ECLAC and to intergovernmental bodies, and offers technical assistance to countries on population and development issues, including demographic dynamics, international migration, population aging, among others. Formerly, she was the Director General of the National Institute of Statistics of Paraguay. Zulma, you're welcome to walk us through the role of NTAs, its use in relation to the demographic dividend. Welcome.
Muchas gracias, Allen. Muy buenos días.
Thank you very much, Alan. Good morning, afternoon, and evening. First of all, I would like to thank the working group that organizes this webinar series for this invitation to participate here. And in this short presentation, I will take the floor not as an expert in terms of NTAs, but rather as a user of the same, as it relates to the analysis and assessment of public policy in the region that concerns us in CEPAL. Next slide, please. Okay, so Sabrina provided the context, a clear context of the demographic transition happening in our region. And I would like to talk about some relevant aspects on the use of this methodology for public policy in Latin America. With that in mind, it is important to understand that the development context of this region is characterized by high inequality, informality, and a quick aging of the population, as Sabrina also mentioned. As a matter of fact, the population range of 60 will almost triple-fold in the next years, which will be a fourth of the population in 2050. So in this context, the NTAs contribute to the design of prospective policies that consider demographic change, because they allow to quantify the income, the consumption, dependency, transference, and the assets across the lifespan of this individual. So this really becomes a practical tool to what we call in the UN a society for all ages. Next slide, please. This methodology of national accounts for transference is basically a synergy between the principles of demography and economics, because this allows to understand the impact of the populational growth and the age structure on the economic growth. So this constitutes a sort of satellite account per age group, because it measures the economic activity per age, and it is sent via resources by the government that support families and markets. Therefore, we understand that these definitely will have a big consequence on economic growth, financial sustainability, and inequalities as in every generation, therefore the relevance of its application. Next slide, please. This methodology that was developed by Ronald Lee and Andrew Mason, who participated in this webinar series as well, have created a global network where the use of this methodology has really expanded, as you see here in the slide, from 7 countries in 2 countries in 2003 to almost 10 in 2024. We've also seen an expansion in the use by countries, because in 2003 only 2 were using the methodology, and in 2024 around 14 countries are using the methodology actively. Next slide, please. As part of CEPAL, in the last 15 years, we have carried out various projects related to NTAs with various partners. So the activities of these projects included technical assistance for production, updating, and use of NTAs for public policy assessment, as well as the development of training and workshops that were applied regionally. This work has been carried out in collaboration both with public and national and partner associations of the United Nations, of which we can find the UNFPA, which is practically a strategic partner for the implementation of these projects in our region, as well as the economic and social projects from New York. Next slide. We currently are working on an ongoing project in collaboration with DESA that we are implementing in 8 countries, 4 in the Asia Pacific region and 4 in our region in CEPAL. That would be Colombia, Costa Rica, Jamaica, and Uruguay. This project that is called sustainable and economic and inclusive economic growth in Latin America and Asia. It points towards the development of a new methodology or a desegregation of the national transfer accounts that we have called the inclusion national accounts. This would be the 3rd manual that would be published around this methodology. The first one was the transference national accounts. The second was the national transference accounts on time, and this one would be the inclusion transfer national accounts, which would allow to measure the impact of aging in terms of inequality. I will not go into detail on this slide because you will have access to these slides and you will be able to read them more in detail. Next slide. Likewise, this is something that I'd like to share with you as well, which are the key thematic areas that were analyzed in the various studies that were applied in each of the countries as per the methodology. And these ones address gender, demographic dividend, education, socioeconomic inequalities in NTAs and in the CNTTs, as well as tax issues and other projections. Next slide, and then the next one. Next slide as well. Here we can see the different countries that have applied this approach and the conclusion. And here I would like to stop for a second for those who do not have seen this methodology so that I can share what are the main results and the analysis that can be developed using this methodology of the national transference accounts. First, the economic dependency of people varies per age. So you can understand that there is a need for consumption and also their production capabilities across their life. So what we can see here is the typical graph that comes from the application of an NTA methodology that refers to the issue of income and consumption per age as per this methodology, and it allows to understand the stages where people consume more than what they generate depending on their work. So typically in childhood and in the old age where the deficits can be perceived, and also where there's a superavid where the income goes over the needs for consumption, and that's where that superavid occurs. So this graph shows the profiles per age for the medium age in Latin America using labor income and consumption, which is also calculated by the medium age between 20 and 35 years of age, because this is the age range with a greater level of occupation in most of the countries. And what we see here is that work income includes formal and informal sectors. And understanding that, the per capita consumption profile, which is the blue line for the average of the countries in the region, allows for an understanding of a relatively stable from 20 to 25 years of age, with an increase around 45 years of age and a small decline starting at 65. So it is important to mention in any case that the average consumption of people around 64 years of age is 35% of the average of their income. And this decline for this group of age in Latin America is actually different to higher income countries, where consumption increases as the age increases as well. Now, in terms of the per capita work income, even though it goes down starting at 55, it stays with positive values until very old age, which indicates a strategy of the countries in the region to contribute to the maintenance of the consumption levels, given the characteristics of the job markets in our region, which it is possible where the continuity of work allows for allows for the informality of work conditions and also the persistence of problems in the pay for older people. It is important as well to mention that this includes 3 channels where we see 3 areas: the deficit and the superavid, depending on the economic areas, for example, reassignment of assets. And as per this chart, we can see that people older than 64 base their subsistence in public transference, which is basically the retirement that they get. So this chart also shows a great variety in Latin America, depending on the super avid period. That is to say, the stage where their income is greater than their consumption. So we see on the one side a very small, short period, which is around 26 years, and the people under 30 and over 56 experiment this period of deficit. The differences are also equally important in various countries, depending, for example, 14 years of age to 33 in Chile. And the most salient group here is in El Salvador, where we don't see a superavid in any age, which indicates that consumption exceeds income at all age groups. This has been explained by the money that Salvadorians send to their country when they go abroad. Next slide, please. Another very important point to understand is that NTAs allow to compare Latin America with other regions in the world. So we know that at younger ages and older ages, consumption goes over production, which is this area. And when we analyze this cycle of life, or the deficit of cycle of life, that's what it's been called, as a proportion between 30 and 40 and 49, as our authors Turay and Fernandez are doing in CEPAL, we observe with these diagrams that Latin America, the deficit of the cycle of life between ages 0.5 and 19 is among the highest in the world, together with Europe and North America. Likewise, the deficit of higher ages, which you can see at the right of this screen, is very similar to North America, Europe, and Oceania. So this is why we can see a greater, more significant income at these ages. Next slide. Now, in terms of the best applications of NTAs, we can see the prospection that can be done And in this case, Comelato, which is an expert in Argentina, created this projection, which is an aggregate of the consumption for 6 countries in the American continent, which is a projection until 2100. And what do we see in this exercise? Well, we see that there is as an increase in the size of the deficit as age moves on. And this, of course, has a very significant impact on the quick aging process that is happening in our country. Therefore, there's a great proportion of consumption that would occur during this stage. Therefore, these changes imply at a society level the need of redirecting resources that currently are given towards funding the deficits of consumption at the beginning of the cycle of life and redirect them to the funding of consumption at the end of the cycle of life. So even though this does not mean a need to fund greater levels of consumption, it's rather an adequation, a balancing of resource transference to the new reality of cycle of life of the countries, and of course, helping in this way to rebalance the social protection programs, labor protection programs, the incorporation of women into the job market, among others, which are some of the applications of public policy that can result from the use of this methodology as well. Finally, I would like to mention as well that all of these studies are available on the website. If you go to the next slide, please. You can access all of these studies via the link that we can see on this slide. And this would be the end of my presentation and also available for any comments and questions afterwards. Thank you so much for your attention.
Thank you. Thank you very much, Zulma. Next, we are honored to have Professor Latif Dramani, a director at the CREG Institute and University of Thies. For those of you who have questions, feel free to use the platform for the Q&A, or you can post directly the questions in the chat. Professor Dramani is a professor of economics, and he's currently been engaged in the implementation of the African Union's roadmap on the demographic dividend and has contributed significantly to development of different tools and generation of gender-specific evidence through several innovations. There is so much that he has done, and we are happy to share the link. In case of more information about him, feel free to join or check out the link. Welcome, Professor Dramani, as you'll be sharing with us and discussing the 2 presentations that we'll be having. Please note that Professor Dramani will be presenting in French. Welcome, Professor Dramani.
Okay, merci. Merci, Alan.
Thank you, Alan. Thank you also, Sabrina and Zulma, for their presentation. I would like to thank the whole team, really, who was able to organize this work, this webinar. So my presentation will focus, it's actually a discussion on the 2 previous discussions that we just heard. So Zulma really, she made my work very much easier, and Sabrina also, because they already introduced the case of Latin America. So I'll talk a little bit about what's happening in Africa and some European countries. Next slide, please. Next, yes. So I'll echo what my 2 predecessors. So they've talked about Latin America. So this is a table representing Africa. So you see divided in region East, Central, Northern, South, and West Africa. And what we can see is that from the perspective of youth and aging population, Africa is still a young population, even though aging is, we can see some signs already of it happening. So this is the first kind of landscape. So compared to Latin America, Africa is still a young country. Next. As you can see on this table, on the total fertility rate, you can see its progression, its evolution. Into 2023, this is where we stand. So we are around 4, let's say around 4 in average, 4 children per woman. And this is the result of the demographic transition. And if we compare to Latin America, right now, Latin America is at less than 2 children per woman. So there's still quite a difference. And there is a population aging. But here in Africa, what we can see is that we have started our demographic transition, but we still have a very young population. Next slide, please. So what I was saying earlier, Zulma really made it easier for me because it's exactly same methodology that we've used, the NTA methodology. And our working group supports more than 30 countries in Africa to implement this methodology. So we've worked in the Seychelles and in the Indian Ocean, and today, so this is the same methodology that's just presented a little differently here, but it's what Zulma already discussed and presented. And what I'd like to say perhaps is that today we work as a network throughout the continent. Next slide. Okay, so I wanted you to see, because Zulma already talked about the methodology, so I wanted you to see the results. This is a selection of countries. In red, you can see the production, right? Income, labor income. And in blue is the consumption. So I'll focus more on consumption here and on issues related to aging. So you can see that you have almost 3 generations here covered. So we talk about generational transfer. So what you can see here, overall, the trend for most of economies, we measure well-being through consumption. So this is what we look at here. So if you see most of these profiles, these country profiles, you can see that these African countries have profiles where consumption lowers with age in most of these countries. For instance, Mozambique, Ethiopia, Nigeria, consumption lowers with age towards the end of the life cycle. So this is one key point. And we'll see this in other countries. And we'll next slides, yes. So compared to Latin American country here, what you can see is that the trend is globally the same. It's very similar. You can see consumption, but you can see that in Argentina in 2016, it increased very, very slightly towards the end of the life cycle, but that was kind of an outlier because most of the other countries had the same trend. So what does it say? It says that people grow, but they are still poor. I mean, people grow old in a poorer condition. Next. In other countries, Zulma also mentioned this, but in other countries with higher income, you can see that consumption increases with age. In Germany and the US, consumption increases with age, and this is what I want to show here. This is the goal of this discussion. It's not the same. Latin America is closer actually to Africa from this perspective. Next slide. So here we took the ratio of senior consumption per compared to the average active population, and in most countries in Latin America and Africa, it's around 1 or under, which means that people consume less, right, than and in these countries, we don't expect consumption to increase with age. And this is a big problem from the perspective of the care economy and social protection. And that also underlines the need to implement public policy to reflect and take into account the aging population, especially these countries who are going through the demographic transition. When you see at Latin America, when you look at Latin America, senior consumption is actually lower than youth consumption. Next slide.
Thank you, Dramani. We're running out of time. Do you want to go to the last one? Thank you.
Okay, so I'll sum up and I'll conclude saying that we need public policy to take into account the aging of population. Thank you for listening. And I'll, thank you so much.
Great. Thank you for discussing the two presentations, Latif. Now we welcome Dr. Milena. Dr. Milena is a senior health specialist at the Inter-American Development Bank, and she holds a PhD in global health and population from Harvard University. I have shared her link. Kindly just click there and then you get to know more about her. But for now, we most welcome Dr. Anna Milena.
Good morning, everyone. Thank you for the invitation for the webinar. While we wait for the presentation to be presented, I would like to thank the invitation, and also I wanted to talk to you today about what our earlier presentations have shown us, that there are profound transformations underway in our region, in Latin America and the Caribbean. And we wanted to talk to you about what these changes mean for the health systems and how can we support better for them to be prepared to adapt. I am, as I was saying, we work for the Inter-American Development Bank, and this presentation is going to show examples of how we support the country with these goals. Next, please. So I wanted to give you, I'm going to go very fast because we have seen it. I think Sabrina did an excellent job in the overview of the demographic transition in Latin America, but just to give you an example of 3 countries that are at different stages of the demographic transition. We are witnessing major demographic trends. This can be reflected in 3 main shifts. We are living longer. The life expectancy is growing. Is increasing over the last decades, and now is above 70 years in all countries across the region. The fertility rate that we also saw, there has been a significant decrease in all countries, regardless of the point at which they started in the 1950s or 1980s. The fertility rate has been converging across all countries at replacement level above 2.1 children per woman. We saw with the previous presentation, Latin America is being is quite standardized in the transition as opposed to other regions in the world. And finally, next, the most important and probably the most striking is what is happening in the region is the rapid aging. Our populations are aging and are doing it in a very vertiginous rate. What does that mean for us and for the health system and social security systems? As you can see in the graph, around the 2020, the Latin America region has a percentage of people over 60 around 13.7%. And this locate us the same level as other regions like Asia, for example, and North America. But in the next 50 years, that will increase so that the Latin America is going to outgrow all regions and it's going to reach the level that estimates the level of Europe. As we already saw, this has important significant changes in the old age dependency ratio that is projected to double from 8 working age adults per person, age 65, to only 4 by 2050. Next. So these changes in rapid aging and lower fertility, of course, what is concerning for us is rising pressure, financial pressures in our healthcare system and our economy. Population aging alone is projected to increase public health spending by an average of 1.5% of GDP in the main Latin American and Caribbean countries between 2050 and 2065. This is something that has been suggested in the previous presentations, but we can see here in the graph that is going to happen across the region. How this increase on consumption and spending is going to be covered is going to be one of the major questions for our countries and our health systems. It's important also to mention that although our region is going through the demographic transition, there is still confronting gaps in maternal and child health and the rising burden of non-communicable diseases. This triple burden of disease is going to confound the way that the countries can respond. Next, please. Next slide, please. Thank you. So when we estimate and see how the health systems are being financed, what we oversee and what we identify is that there is an underinvestment in health and particularly in prevention and promotion activities. Health spending as percentage for GDP in Latin America is in average 6.9%. This is lower than the OECD average that is around 8.7%. But more than that is that the expenditure is not being efficient. More than 50% of this spending is being allocated to curative care and not to prevention and promotion, which is going to be the main activities that can reduce the burden of disease and ensure a healthy aging and the healthcare system can deal with the extra demand. I think it's important to mention that only 4.6% is invested in health promotion. Thank you. Next one. So this is not the whole story, isn't it? The region has been going through demographic transition, but this has not been equal or equitable. The benefits are not equitably distributed, and it exposed the disparities across and within countries. And we can see that in this map. This is the differences in life expectancy gains within countries and across the region that can be between 7 and 10 years within one country, for example, Mexico or Brazil. One part of these disparities, of course, that have a social determinants in health is an economics, is the increasing in the burden of non-communicable diseases that are normal as the population age. However, our region has a burden, important significant burden in the population that are younger, in the working age population, and that is avoidable mortality that we used to call it. And we wanted to talk about that a little bit later. Thank you. Next one. So as an Inter-American Development Bank is one of our institution work in the region, I want to talk only about the work on the health, nutrition, and population division in the IDB. It's important to note that the IDB has integral solutions for the region. We have an education division, we have a labor and social security division, we have the economic division and the migration division. So all of them are working and accompanying the countries in this demographic transition and their effects, but we were going to talk quickly about health. We have 37 loan projects in the region, 122 country technical cooperations, and 26 regional technical cooperation, where that's amount in terms of the loans in the current portfolio of $4 billion. We're working in each region. Thank you. Next one. So what is our institutional strategy is telling us to how to accompany and support our countries and to deliver impact and scale in the health sector to improving lives is 4 main directions. The first one is to address risk factors and social and environmental determinants of health. The second is to improve the quality and resilience of health services. The third is increase the efficiency of health spending. And the third one is to strengthen and boost digital health solutions. Next one. I have already talked about this, so next one. So I wanted to give you 2 examples because of the time. Next one, please. The first one is about, and I think I wanted to stop here because although we know all the effects and the methodologies that we have been seeing, the impact that it will mean in the demographic transition, that is important for us to know how we are going to help our countries in reality, in operation and implementation. So this is the first example. It's an example of a project that we have in the bank in different countries, but this is the Dominican Republic, is to strengthen the primary health care for NCD management. And the perspective is a life cycle perspective. We wanted to support, and the country is supporting the health promotion and prevention for adolescents, young children and adolescents, ensuring the timely diagnostic and treatment and management of non-communicable diseases, diabetes, hypertension, focusing on primary health care, which is going to be the door and the main actor in order for us to achieve our goals, strengthening supply chain of medicine and medical supplies, and finally, strengthening the coordination of health system functions to address chronic diseases. This is talking about evidence, data, programming, how to help the countries to estimate and to be prepared financially for the next couple of decades. Next, thank you. Next slide. Thank you. Just to finalize, our second example is about the Mesoamerica Health Initiative. This is focusing in maternal and child health. It's from between family planning to prenatal care to obstetric care in 8 countries in the region. It was mobilizing 132 million and leveraging 44 million of domestic funds. But specifically, I wanted to talk to you about the Costa Rica project. Next one. And this project is about adolescent fertility, how to reduce adult fertility the same way that Sabrina was showing us that is one of the main problems in inequality in these demographic transitions is about adolescent fertility. We wanted to show that in a 2-phase financial-based performance project, which was Mesoamerica, strengthening capacity building, but also helping the quality of care and accessing adolescent-friendly services, we were able, or the project was able to reduce 11% of the fertility rate in the region. This is only 2 examples of what we wanted to show. There's many more to do, so I wanted to invite you, next one and final, to visit our website, our website and our blog for all the projects that we have to support our country's health systems. Thank you.
Thank you very much, Dr. Milena. I want to thank everyone online. We are 4 minutes past the time. and our translators have to be off. But I want to really, really thank you. A link for those of you who registered will be shared, and you'll be able to access this recording and all the presentations here. I also take note of the Q&A, the questions that were coming through. Maybe just as we wrap up in 1 or 2 minutes, because we have to switch to other meetings. Amarachi?
Yeah, thank you. Thank you so much. Thank you to all our speakers for a wonderful presentation. I just found out that we can't start the other meeting unless we end this one, and we are already 4 minutes past time. So thank you all so much, and we'll be sharing this recording and the presentation to everyone who joined.
All right. Thank you, everyone. The last slide will just show you, for those of you who are interested in joining the committee, we're happy to have you attending the subcommittee meetings that run every month. And we have to end here. Thank you, everyone. Thank you for the excellent presentations to our presenters. Thank you.